In fact, in India, 50% of the people who are detected with breast cancer happen to be under 50 years. I thought this is something that I want to do the rest of my life. And so I quit my job and started NIRAMAI.
So today we have with us Dr. Geetha Manjunath, who is a computer scientist and entrepreneur with over 25 years of experience across technology, innovation, and research. She and her team at NIRAMAI are developing novel software to detect breast cancer at a much earlier stage than traditional methods or self-examination. The solution is low-cost, accurate, automated, portable cancer screening tool that can be operated by a simple clinician. Over the years, Dr. Manjunath has led many innovative projects in healthcare and transportation, especially catering to the emerging markets. She is also the inventor of 14 US patents with more pending around. Thank you so much for joining us, Dr. Geetha. It's a pleasure having you.
Thank you. Thank you very much for inviting me for this forum. Happy to share my thoughts and sort of learnings, doing NIRAMAI, which is developing a new way of detecting breast cancer, as you mentioned.
And just to start with the conversation, so what started with thermal imaging is now an AI and machine innovation-led, diagnosis for breast cancer. So how did you come up with this idea?
Yeah, so actually I'm a computer scientist, an accidental entrepreneur, if you can call me that way. Yeah. It's more situational reasons that I ended up starting NIRAMAI along with my co-founder. Basically, I hold a PhD from Indian Institute of Science, and CDAC before. When I was in my previous organization, I was working with wonderful, smart team members, researchers, as a research manager for data analytics, leading the analytics research for India. We were working on several interesting problems in healthcare, transportation, education, customer care, and so on. Mostly for the US and the European, use cases. Having said that, we did have a small exploratory, activity on trying to innovate for the emerging markets. And in that constitution sort of exploratory activity, we were doing several India-centric healthcare, innovations. I was discussing with doctors and so on. And on that time, one of my cousin sisters, Bharti, got detected with breast cancer. She was very close to me. We used to play together and all. So it was very shocking, and I started reading about breast cancer and what's the state today. And I just realized that there is no test for detecting cancer in younger women under 45 years of age, right? And there are many, many cases of breast cancer that's being seen under 45 years of age. In fact, in India, 50% of the people who are detected with breast cancer happen to be under 50 years. So it's very pathetic because there is no test for detecting accurately any early stages of breast cancer. And early detection is very important because that is when the treatment will be more effective and so on. So that is where I started reading about it, and then I started a small exploratory project to try and see if we can use imaging algorithms, machine learning, to detect this, right? So that's how it all started. After about 2 years of research within the organization, I thought this is something that I want to do the rest of my life, and so I quit my job and started NIRAMAI with a couple of my friends and team members as well.
Great. And since your focus has been to work in the emerging markets like India, and which has a lot of women who still don't have access to diagnosis for a breast cancer, even when the same is curable, like you mentioned, with early detection, as the case is. So how does your innovation come into play to make it affordable and accessible for these emerging markets, and especially for these women in tier 2, tier 4 kind of cities?
Yeah, so current methodologies, as I mentioned, do not work for under 45. What is interesting or maybe astonishing is that most women in India and other places detect, irrespective of their age group, detect breast cancer by hand, right? The reason being the affordability and accessibility challenge, right? A test which is about 3,500 to 4,000 rupees is not really affordable at all, especially if it's a preventative measure. That is, you want to get the test done irrespective of whether there's a symptom, whether the person has cancer or not, right? And for that, a 4,000 rupees test is a lot of money, and that's a mammogram. And it's very good. I mean, it's effective when it's subsidized by our payers, and that's easier. But when an end user has to pay, this is not a test that will work for rural India. And so what we have done is to use a very simple mechanism for sensing the abnormality in the body. That is using thermal imaging. Just using a thermal sensor, which is placed 3 feet from the person, we measure the temperature variations on the chest. And then rest of the smarts is done in a software. We call it Analytix. Now with this, what happens is that the device itself is 1/20th the cost of a mammogram for a hospital. So more and more diagnostic centers, smaller institutions, NGOs, all of them can afford to buy this device, first of all. And then, so that reduces the capital. Next, also the test can be conducted by simple training for a 12th class person, right? Just 2 days training is sufficient. As long as she knows how to use a computer a little bit, we can train. And now every person now knows how to use a mobile, and that's also sufficient to actually learn how to do the test on people. So what happens, the operational expense also comes down. And then the third piece we've done is to make the report, or what we can call is a provisional report, completely automated. You don't need a doctor to actually say whether this person is of high risk, needs to be brought to a hospital or not. So we call this a red, yellow, traffic light output, right? Red, yellow, green. So if a person is red, she needs to come to the hospital immediately. If she's yellow, she needs to repeat the test in about 3 to 6 months. If she's green, she can do a regular screening once in a year or once in 2 years. So this output can be given completely automatically. So what happens, the end-to-end cost of the solution reduces so much that we can make it many more people go through this test because it becomes more affordable. It is also accessible, as I mentioned, that many more providers, healthcare providers, can also afford to give this test from an expense perspective. So that is how we make it. And another aspect we have brought in is the shyness that is there in rural women generally to do in front of others and so on. So make the test very privacy aware. Nobody's inside the room, right? Nobody sees the person, nobody touches the person. There's no pain or radiation. So this kind of a simple privacy aware test is loved by every lady because it's like a changing room. You just go inside a small booth, the person has to disrobe, but then nobody's around. So it's actually much more comfortable. So that's with this also, we believe we have made the solution very, friendly to all of India.
How do you see AI and machine learning then becoming, the spearheading innovation in terms of taking forward the contactless diagnosis in the future for the whole healthcare sector?
Yeah, AI and machine learning is almost changing the way, healthcare delivery is done today, right? I always feel that AI is made for India, because we have huge population, underserved population, I would say, in the rural areas, because there are not many experts out there, clinical experts, to provide the care at the time of need. And on the contrary, in the hospitals, in a reputed hospital, you'll see overcrowding. Every doctor is so overworked, he or she doesn't have time to take a sip of coffee, right? There's so much need for productivity improvement there, or rather, enable the doctor to do things much faster, right? So in both of these situations, I feel AI can by tools such as what I mentioned, like using AI-enabled robots, if you will, to do some analysis of the patient data, to identify people who require an immediate critical care, and then bring them to the hospital, bring them to an urban, equipment healthcare facility, is something that we can definitely provide as point-of-care devices in the rural areas, AI-enabled. And in the urban areas, what we could do is to provide these AI-enabled tools as additional tools, helping the doctors to make the decisions much faster, make it obviously database decision making. So can also reduce the errors in decision making, because when the doctor is, looking at so many hundreds of patients per day, there can be a scope for error and also fatigue and so on and so forth. So by adding these tools, which will act as a second opinion for the doctor himself, right, to just say, okay, AI tool, what are you going to say? And then looking at that and then making sure that they make the right decision using all the data that's available. So both these places, AI tools can help a lot. And so irrespective of whether it's contact-based or contactless, obviously contactless or imaging-based mechanisms are preferred due to the current situation. Imaging in different spectrum gives different information about the body itself, which can be analyzed, and AI tools or which are pattern recognition based, are very good at image-based analysis, right? They're actually better than human beings, because what the human beings can perceive with bare eyes and then analyze with simple analysis, can be overpowered by extensive training of these machine learning models, which can do the pattern recognition based, imaging based analysis in a much more accurate fashion. And that's the reason why tools can be helpful to the doctors as well, and they can become like provisional doctors in some sense wherever it's required, right? So I think that's the reason why AI-enabled contactless, if you will, imaging algorithms will play a huge role in enabling better healthcare for everyone in India, particularly.
Surely. And the aspect that you also mentioned about the same thing, coming back to it, that the women in rural areas, or even for that matter, any other person in a rural area, is kind of skeptic about the diagnosis that any doctor does. So much so that they just go to their own houses and their own homemade remedies for any cure that is there. So how do you think that we can increase the acceptability of such diagnosis? Because again, if we talk about breast cancer, so people might think that there's a home remedy for it and then go for it. And the reason just basically being that they're not trusting the doctor enough to be the one to cure them. So how can we increase the acceptability for such diagnosis or even such medical practices to reach to these masses?
Yeah. Yeah, so of course it's a challenge, anything that is, done by tools, by computers can make error. And so it is developing the trust in computer generated output is a bit of a challenge. So one way to do it is to mediate it with a doctor, mediate it with a clinical expert who is already convinced that this is working pretty well, right? By how are they convinced? They actually look at clinical trials. So we do very, very formal clinical trials where our test is compared with mammography, ultrasound, and also, right? All of the tests put together, we kind of compare that with the results of the current test, like an examination paper, and the doctor needs to be convinced, and then the doctor will say, yeah, this tool is working. You can trust it. It does work. Right? That's one way of enabling trust or increasing trust in AI-enabled tools. The second thing is really about once a person is known to be or detected to be with some abnormality, when she goes for a follow-up test, that also recognizes some abnormality, then she'll say, okay, fine. I have received many calls where the women say, right, thank God I took a NIRAMAI test, because otherwise I wouldn't have known that there was a problem. So, right. So that angle will come in when a positive patient whom we detected turns out to be, positive, and she gets cured, and then it really helps. So these are the two sort of, key ways of clinically getting accepted. Then this third part, as long as the experience is good, right? So there, you can't leave the person around, you have to have a person in the middle, right? It could be a healthcare worker who is able to communicate to the end user, empathize with the end user or the woman who has come for the test. That element of human interaction has to be there, right? Whether it's a 12th class person or a doctor, there is this human touch nature. That kind of a soft skill needs to be there. And I think a coupling of a very humane, if I can say, health worker with the doctor, with the AI doctor, can move the needle, even in the rural places.
Definitely. And now coming to the end of the conversation, so what are some of the other applications of the current methodologies that you're looking to explore, be it in healthcare or otherwise? And are there any partnerships that you intend to create in the future to expand the usage in, say, other innovations in the space?
Yeah, definitely. So what we have innovated, the technology we call it as Thermalytics, is currently, of course, clinically proven for breast cancer detection, early detection of breast cancer, in fact. We've also worked with, thankfully, Bill and Melinda Gates Foundation. In fact, we are doing the research to see how this technology can be used for what's called as river blindness, to detect this disease, which is a skin, it's a parasite under the skin, which we can detect using the technology that we've developed and save many people from becoming blind, right? So that's the other methodology. The third one we've started working on using the same technology is for COVID, right? So where we have used this to detect respiratory issues, if the person has high fever, essentially COVID symptoms. Whenever after the lockdown, we have many of the offices open, so people are walking in public places, you have a rush of people walking in, though they're trying to maintain social distance, and also you make sure that there is no person with high fever or COVID symptoms entering into these places. That can be done with thermal camera and the software that we have developed uniquely for this called fever test. So that's the third application we've started working on. In general, Thermalytics can be used for detecting many other type of cancers and many other type of abnormalities in the body. Of course, we need to sort of do some kind of minimal retraining to ensure that the models are able to detect those abnormalities. Having said that, I think what we have so far done is just scratch the surface of what's the potential of the technology we have developed. We are looking forward to partnering with many hospitals, the community workers, and also government in particular, to actually develop this technology to enable detection of many other type of issues, which a human eye cannot detect, or even current imaging methodologies are not able to detect accurately enough. And so I look forward to partnering with, because it's a huge job. It's not a one person's job or a 50 people, my team cannot change the world, in such a large extent. I always believe collaboration is a way. So I'm very happy to partner with, companies such as yourself, CSR Box, if you're able to get some CSR funding to many of these screenings, so many women will get benefited, right? So it's really about collaboration and partnership that can actually take the technology to masses.
And I wish you all the luck that is there to take this forward to every individual possible out there and make it more accessible and affordable for every woman to kind of get the diagnosis that they really require. And that brings us
Thank you very much. Thank you very much.
It's been a pleasure, Dr. Geetha, to talk to you. Thank you so much.
Pleasure is mine too. Thank you so much for featuring NIRAMAI on this channel.
Thank you.